Welcome, everyone. Dr. Tim Colbert with you here again for the HeartMath Clinical Certification course for Stress, Anxiety, and Emotional Regulation. This is class number 6, Multi-Session Protocols and Special Populations. Thanks for joining us again. Let's start off this class with a heart-based quotation. Wherever you go, go with all your heart. That was stated by Confucius. And certainly it's my sincere hope that after completing these 6 classes, you will go with all your heart. You'll pay attention more to your heart intelligence, and that'll help you and your clients to function more successfully and happily along the way. As we also like to do, we like to start each class by getting a bit more coherent and practicing the technique that we had learned in the previous class. Now, we had learned the freeze frame technique as our final coherence building technique for this course. So let's review a little bit about that technique and then practice it again together today. The freeze frame technique, in essence, helps you to slow down a little bit, in particular, slowing down your mental and emotional processes or reactions so you become more aware. It allows you more time to become aware of any subtle emotions and attitudes that might be depleting you, but it also allows you to become more aware of other sources of information for yourself, for example, in accessing intuitive abilities and senses or capacities, so that ultimately you can generate more creative, interesting, broader solutions, especially with situations or issues where you might feel stuck. We use the term freeze frame to denote this idea that, in essence, it's like watching a movie and being able to press the pause button on the DVR so that, or the DVD player, so that you can really step out and take some time and observe what was going on. You freeze the frame, stop the scene of your life, and you can edit it so you have a different and hopefully more preferred outcome. So that's the idea behind it. With this idea being that once you are able to step back, look at things from a more coherent place, you can generate more effective, efficient solutions. So that's the idea behind the freeze frame technique. It's really great in situations in life where you just feel confused or stuck, and maybe a new approach, especially an outside-the-box approach, is required. So let's practice together. Get comfortable wherever you happen to be. Once again, you can practice this technique with your eyes open or your eyes closed, whatever works best for you. Here we go. First, acknowledge a problem or an issue or any attitude you have or feelings you have about that issue. Focus your attention in the area of the heart. Imagine your breath is flowing in and out of your heart or chest area. Then activate a positive or renewing feeling and ask yourself, what would be a more efficient, effective attitude, action, or solution? Activate a positive or renewing feeling and ask yourself, what would be a more efficient, effective attitude, action, or solution? Now, quietly observe for any subtle changes in perceptions, attitudes, or feelings, and sustain this as long as you can. Commit to sustaining beneficial attitude shifts and acting on any new insights. All right, there we are, the freeze frame technique. You can reorient yourself to the room that you're in and to this class. Hope you get a chance to use that technique soon. So for today, we will discuss a little bit about resources to remember to utilize as you move along in your clinical practice and your own self-care practices using HeartMath tools and techniques. We will discuss and give examples of a multi-session protocols. These are the more complex patients. And also using these techniques with special populations. For example, children working in group populations or with groups. And then also acute care applications of these same tools and techniques. We'll then finish up with some final homework suggestions and give you some other options for learning opportunities and discuss resources. So, as we discussed at our last class, we have this ability to triage patients and do some treatment planning with them to determine whether they would be best in a brief protocol approach, which is typically 1 to 4 sessions, spaced 1 to 2 weeks apart, or for the more complex patients, based on your assessment, people where you would want to definitely think about 5 to 12 or even more sessions, maybe 15 to 20 sessions, and potentially a little bit more frequently delivered. With the complex group, I'm more likely to encourage them strongly to consider purchasing some kind of heart rate variability technology to enhance practice. This is a quote I've always loved. Its title is Complexity in the Mind-Body Connection, but it comes from Green, and Walters. Every change in the physiological state is accompanied by an appropriate change in the mental, emotional state, conscious or unconscious, and conversely, every change in the mental, emotional state, conscious or unconscious, is accompanied by an appropriate change in the physiological state. And this just really highlights this complexity and closeness of the mind and the body intervention and integration and response patterns. The mind and the body work very closely together, and it's a bidirectional relationship. Green and Schellenberger said this: body and mind are one, and the pursuit of health requires a holistic biopsychosocial approach, a very comprehensive approach. So as we talk about complexity with patients and the fact that some of them may do better in a multi-session protocol, which is what today's class is all about, we can think a little bit about all the different ways in which people present and some of the conditions for which HeartMath tools and techniques, heart rate variability work, including biofeedback work, has been shown to be helpful. On the medical side of things, benefits have been seen in essential hypertension, cardiovascular disease, obesity, chronic pain, IBD, autoimmune disorders, dementia, traumatic brain injury, cancer, asthma, and insomnia. On the mental health side, you can see this list, a lot of conditions in particular. I've certainly worked with a lot of kids with anxiety. The psychologists I work with do a lot of PTSD work, And we definitely get a lot of play in this area of anger management. I think that's so important and is commonly linked to stress and anxiety, in fact. It can also be used in tics and Tourette's. I've had some good results there. Grief and loss, as well as applications for individuals with ADHD, kids and adults. And by the way, with ADHD, for example, more than 50% of people with ADHD are known to have deficient emotional self-regulation. So although it definitely can just be used for training to improve cognitive efficiency and sustain attention, it's also really helpful for those kids and adults with ADHD that struggle to emotionally regulate, which is quite common. The complex multi-session protocol typically would involve these steps, which you would repeat at most of these sessions: interim history, baseline assessments, including that psychophysiological profiling, where at least each session you might want to get a 2 to 3 minute baseline resting recording, and then you could choose to also record a patient either doing cognitive stressors like math problems or spelling words, or possibly then also tracing them, recording them while they are engaging in a coherence building technique, to be able to show them these interesting and validating and reinforcing changes in their heartbeat pattern in response to emotionally shifting, feeling differently, as well as thinking differently. I think for this group of people, definitely you want to think about whether they might benefit from referral to a specialist if you're wondering about the severity or the complexity of their illness. You know, nowadays, certainly with the functional medicine approach and related, I think, in-depth ability to analyze things and really look at biological systems, oftentimes it is helpful to work in a team together with other specialists to delineate some of those other factors that may be contributing to a given person's symptoms. Typically with a multi-session protocol, we're doing up to 12, maybe even 15 sessions, more commonly in the office than via Skype or telephone. Typically, in my experience, most of these sessions are more commonly 45 to 60 minutes in length. They can be include or be integrated with psychotherapeutic approaches. And early on, these are the kind of people that might actually benefit from being seen twice a week for a few weeks, or maybe once a week for a few weeks, and then increasing the interval to 2 or 3 weeks after that. Oftentimes early on, to really get some therapeutic change moving along, they need to be seen fairly frequently. With this group, I will typically start once again with heart-focused breathing and quick coherence, the emotional restructuring techniques, emotional refocusing techniques, and then when they built some mastery and confidence with those techniques after, let's say, 2 to 4 weeks, then I'd be more likely to typically introduce either heart lock-in or attitude breathing, and again, encouraging a regular, somewhat systematic practice of these techniques on a daily and weekly basis. And then more commonly, I'd say that I say freeze frame for a later time, but that will vary depending on the kind of clients that you're seeing. I give a lot of handouts. I print them out a lot of things and send them home with things. We do a lot of work with symptom diaries, so they're tracking their progress over time using tools like a visual analog scale, and give homework specifically about frequency and regularity of practice with the various techniques, both in the moment and more sustained or prep style practices. And then I think for this group, more commonly, I'd strongly recommend they consider purchasing a heart rate variability technology, because it really facilitates practice and validation, and I think engagement in the whole process. Some of these technologies, can be purchased really cost effectively. I mean, some of the smartphone-based apps are, maybe just $100 or $150, which compared to a lot of apps out there is not so bad. It includes a heart rate variability sensor typically. And as we discussed in class 5, we will determine whether someone is a candidate for the multi-session protocol based on, number one, certainly the chronicity of presenting complaints. You know, people that have had symptoms for a very, very long time, of course, are more likely to need many, many more sessions to turn things around and reset that baseline pattern. Also, people with multi-axial complaints. Certainly, I see a lot of people with both physical and mental health complaints, and that's not uncommon when you think about depression and anxiety in particular. Many times, somatic or physical complaints go hand in hand with those mental health presentations. So, things like chronic pain, headaches, joint aches and pain, stomach aches, as well as insomnia, trouble staying asleep or falling asleep, as well as fatigue. These are commonly things I see together with symptoms of ADHD, anxiety, and depression. And so for addressing multi-axial complaints, we have multiple goals in mind in terms of improvements and what the patient would like to accomplish. We're by nature going to, of course, need more sessions to do that. And typically, with many of the people that I'm seeing, I'd say 6 to 8 is a pretty common number of sessions. I don't typically go to 12 or 15, but if people are also integrating psychotherapy work with their HeartMath tools and techniques, that could very well go on for, 12, 15, 20 sessions. That'd be fine and wouldn't be necessarily uncommon. Also, over time, what we want to do is be tracking their coherence and heart rate variability levels as one marker for success, if you will, or improvement. And so I think depending on how that's coming along, that would be a further sign for you as the clinician to determine whether they need more frequent sessions or just more sessions in general. I mean, typically I would say that most people are going to be gaining some coherence, even a small amount, and potentially some HRV improvements within 3 to 5 sessions. And at each session in the office, I'm actually only training with technology for maybe 10 or 15 minutes. The rest of the session is oftentimes, discussing other things and reviewing progress, etc. And then environmental factors have to be considered as well. For example, if you have someone working in a stressful workplace, or you have somebody working or living in a dysfunctional family, that can add a layer of complexity that would kick us into that multi-session protocol and might mean that we'll need to see someone for a longer period of time. And then finally, the patient goals and also the referring provider's goals. How extensive are they? Do they really want to achieve improvements across both physical and mental health symptoms, and how broad are those goals? And so all these factors, of course, will influence the way we end up deciding how to do things. Now, overall flow of a typical multi-session intervention protocol session then, number one, don't forget to prepare yourself ahead of time. So whether you want to do a brief heart lock-in before you see patients each day, or whether you do better with a brief quick coherence technique, maybe between or before patients, that's fine as well. But definitely take the time to help yourself to be more coherent. It'll improve your interactions in many, many ways, as well as make you a better listener, which we've discussed in terms of the coherent communication technique. In terms of assessments, we talked about using intake forms and then doing that psychophysiological profile, and then at each visit getting, of course, interim history. If you're measuring visual analog skills, that can be a convenient way to map progress in terms of those numerical ratings, and have them bring those calendars each and every time to show you. I tend to use the depletion to renewal plan at just about every visit as a continuing way to reestablish goals, discuss where we are in terms of achieving goals, and continuing to educate about the role of emotions with regard to stress and feelings of depletion. We want to train and educate in the HeartMath techniques in some organized way, emotional refocusing techniques and emotional restructuring techniques, and then use the technologies as needed. Now, as you get into multi-session protocols, we've not talked about this a lot, and we don't do a lot with technology within this course, but know that on many of the systems that are available for use that measure heart rate variability, there are really useful game features. And these features commonly utilize multimedia graphics and sound to make the user experience more pleasant, and it's basically what has been called the gamification of some of these healthcare technologies and tools. It allows practicing of these techniques to be much more pleasant, interactive, and motivating, and actually, quite reinforcing. On some of the technologies, you'll see a numerical score given, in essence, an achievement score that accumulates and reflects how much coherence you are achieving, and that's a great tool to use in terms of rewards and practice parameters. You might want to give a client to earn a certain number of points every day. For other people, these game features are wonderful. For example, there's a game where you fly a hot air balloon around, and the more your heart rate variability is in the higher coherence zones, the faster and more efficiently the balloon flies through these beautiful landscapes. And you can also track an achievement score, a coherence score during this time, and try to get as many points as you can. So games like that are very useful. The other option is you work in multi-session protocols, because people do get bored if you do the same thing every time in the office, and let's say you only show them the tracing on the main screen. And so the other technology I've liked, and many of the systems offer this, they usually are referred to as emotional visualizers, but they typically combine, let's say, a beautiful nature scene or an interesting and pretty geometric figure that moves or changes over time as you move in and out of higher levels of coherence. And those are very useful and helpful and fun for people to play with for longer training sessions where you want them to sustain coherence for, let's say, 15 to 20 minutes at a time, but you want them to have something to do that helps them to stay with it. So those are very useful as well. They commonly also feature relaxing music of some kind behind the visual display that's occurring. Very useful. And so in the multi-session protocols, you're going to want to introduce those games and emotional visualizers very regularly. In particular, I'd say beginning at sessions 4 and 5 and beyond, so you really hold the client's interest. And then along those same lines, some of the systems feature training screens or sequences where a narrator will talk a person through a given relaxation technique step by step, and those can be useful as well for home practicing for many of the clients that we work with. I think at each visit, you want to revisit the learning objectives and the goals of the patient. Make some attempt, I think, to measure success or improvement or movement toward those goals successfully. And then, of course, assign some practice homework and schedule follow-up visits, which you can vary over time. Commonly, what I'll see is that we go ahead and schedule several visits to make sure they get on my schedule, and sometimes, let's say, a week apart. But if things are going well, we can always cancel visits and then give them a little extra time to practice and then come back if I feel that they're doing well. It's harder for them to add visits because many of you, I'm sure this is true, your schedule is also already very full, and so it's better to schedule them up front and delete them as needed, in my experience. Now, I wanted to give you a nice little review slide just as a recap of all the wonderful coherence-building self-regulation techniques that you've learned, recall that we discussed this idea that oftentimes we will begin with and have the client master the emotional refocusing techniques, hard focus breathing and quick coherence, and then move along to the emotional restructuring techniques, freeze frame technique, heart lock, and an attitude breathing. And you can see the brief description of how this technique might be applied over on the right-hand side. So heart focus breathing is great for in-the-moment neutralization and deactivation of autonomic nervous system arousal. And then quick coherence, where we add that emotional shift, of course, can help us with emotional regulation in the moment, and oftentimes our ability to respond more effectively in a given situation. Freeze frame technique is great for decision making and clarity, and then heart locking, beautiful for establishing a new baseline, and in particular building energy. We'll talk about heart locking today in the service of depression, and when people have depression and low energy or fatigue, how I think heart locking is one of the best techniques they can be using every day to really build that energy back up, that emotional energy back. And then finally, attitude breathing for increased self-control and attitude shifting in those chronic situations where you really need an attitude readjustment. Very effective. Another comment on utilizing HeartMath techniques along with technology. It turns out that when people utilize HRV technologies, they can get more mileage out of them than just using them with the HeartMath techniques. I love for people to understand that you could utilize a heart rate variability technology while you are practicing prayer, meditation, yoga, some other form of relaxation, mental imagery. I do a lot of work with kids and adults with that. Fabulous for monitoring along and just seeing what other physiologic changes are occurring while they are engaging in some other form of a mind-body skill. And I think it can enhance your ability to really get something more out of mind-body skill practice, because when we use heart rate variability technology, we're adding that objective measure, and in essence, that validation that you're doing something that really is health promoting more objectively, when we're getting more coherence and when we're seeing bigger heart rate variability amplitudes over time. That takes the guesswork out of mind-body skills training, in the sense that we know those things are helpful and that you will benefit from them if you sustain those changes, higher coherence and better HRV over time. You'll improve both in mind and in body. And so I do like to add technology, by the way, to other techniques as well, and track heart rate variability over time while people are engaged in a variety of mind-body skills. Now, let's get on next to clinical applications and talk a little bit about the multi-session protocol, where you're working with a more complex patient, someone maybe with deep anxiety or deep depression, and how you can frame that for yourself as a clinician to keep the ideas organized in terms of how you would approach each type of individual. So here's a slide from the Depletion to Renewal Plan that shows you over-arousal, which is sympathetic nervous system activation, of course, and it's rampant in this day and age. I believe that most people, if not all the people that I see just about, are chronically over-aroused. Their sympathetic nervous system is turned on, and it's locked on, and they don't realize it. They're gotten to the point where they're so used to that state, that's their baseline state, that they learn to accept it and even crave it. But again, over time, that's not good for you. And then underarousal, which can occur in and of itself in a variety of biological conditions. For example, low thyroid function would result in underarousal. But also importantly, we know that underarousal is actually sometimes a function of chronic overarousal. So we'll talk a little bit about this idea that the natural history for many patients, and it's just good to understand this over time, is that they'll start in an overarousal state. Medical examples would be hyperthyroidism or actually acute pain, some forms of chronic pain as well. But then over time, that biological function that's hyper-functioning, if you will, over time can burn out. The same is true with mental health issues. A really common one is chronic high levels of anxiety or chronic severe traumatic stress. You start in a high level of autonomic arousal, hypervigilance, everything's cranked up and turned on, but over time you will eventually deplete, you will eventually burn those systems out and end up in a more depleted and oftentimes under-aroused mode. And that's important to understand from a clinical natural history standpoint, is when you think about the patients you're working with, where are they at in this continuum of over-arousal, under-arousal, etc.? And that certainly can inform your treatment. So here's the same thing I just stated for you on a slide. Over time, the natural history of the patient may indicate a shift from over-arousal to under-arousal. The concern is that oftentimes under-arousal in that circumstance really represents a very deeply depleted state, and so you have to be patient, I think, as a clinician, knowing that this may well take a time to get this person bouncing back. Beware of this evolution, so you think about where you are at in the treatment continuum and what strategies, therefore, are best to use. I've always loved this slide. I just like to show this in this context, that anxiety and depression are commonly related in this way, that people that have high anxiety over time eventually get to this point where the arousal shifts to this burnout phase, and they eventually can become depressed and in essence under-aroused, and the two commonly go together and are linked in this way. Now, as we categorize patients or think about how to work with them, let's start with patients that exhibit over-arousal. That would be situations like anxiety, anger, agitation, stress, as we know it, panic. Sometimes people with OCD can be pretty over-aroused as they're very perfectionistic and rigid. I see many kids with sensory hypersensitivities that are very over-aroused, and that can actually lead to anxiety. So here's some of the common situations associated with over-arousal. Now, one way you could think of over-arousal is just the sympathetic nervous system being really cranked up or firing off. But also another way you could think about it is that even at lower levels, still inappropriate, but lower levels of sympathetic nervous system over-arousal, if you have a person that doesn't have much self-regulatory capacity, they have no skills that they can utilize, and they've, are in a situation where they've been experiencing over-arousal for a while, their resilience is low. What's interesting is that over-arousal could really represent this insufficient self-regulatory capacity as much as over-arousal per se. They might not be experiencing super high levels of stress, but because they have so little resilience or reserve, even the stress that they are experiencing in smaller amounts has a big impact on them because they just don't have much in reserve, if that makes sense. So, and in terms of heart rate variability tracings, this would be an example of something you might see on an HRV tracing pretty commonly in someone with high arousal anxiety. And what you see there is, number one, just visualizing this or eyeballing it, a pretty incoherent pattern, meaning not much rhythmic coherence in that pattern over time in any, epoch. It just seems like kind of random ups and downs and almost kind of chaotic, if you will. What you also see in this tracing, and this is common in the case of anxiety, is you see those spikes in heart rate where the heart rate suddenly pops up and gets very, very fast for just 1 or 2 beats and then comes right back down. That's felt to be a release of the parasympathetic brake, as it's called. The parasympathetic nervous system usually, is having some ongoing influence to keep the heart rate lower. and the sympathetic nervous system was what increases the heart rate over time. But when the parasympathetic nervous system sometimes will literally just let go for short, very brief periods of time, sometimes when people are feeling overwhelmed, you can then see this quick spike in heart rate. So that's kind of a classic pattern for somebody with anxiety. And this pattern and this discussion of anxiety makes me think about a patient I wanted to just tell you about that I just happened to see for just the second time yesterday on Friday. But let's call him Randy. That's not his real name, but let's call him Randy. But this is a real case that I find fascinating. So Randy first saw me in mid-July here of 2019, about 6 or 7 weeks ago. And Randy is heading into the 12th grade. He's a senior in high school. Now, he presents with a generalized anxiety disorder. He's probably had anxiety for at least 2 or 3 years, but more and more his anxiety is very much focused on academics. He really wants to do well. He wants to go to a good college, and his parents are very, very keen on this as well. So the truth is, there's a lot of parental pressure here as well. But he came to see me with his father, and they have a very good relationship. But what they described is that last year in the 11th grade, when the patient was in his junior year of high school, he had a lot of anxiety, and mostly the way this played out is 2 things. Number one, at home, he was very irritable with his parents. And then number 2, because he was so anxious about homework, he would procrastinate and leave a lot of the more difficult homework till the last minute because he was anxious about doing it. He knew it would be difficult, and that led to some problems at the end of the school year where he wasn't getting things done. Now, eventually he was able to fix everything and finished this past year, 11th grade, with still almost a straight A average, so he did well, but it was very stressful for the whole family, and the parents really felt that they had to jump in and support him as well and really keep his nose to the grindstone, because his other temptation when he's not doing well, when his anxiety is high, is to engage in a lot of electronic video gaming with his friends to excessive amounts. I mean, I'm talking, 4 or 5 hours at a sitting and staying up too late and missing sleep because of that. So a lot of things going on with him this past spring. And at the time that he was experiencing the highest anxiety, I gave him a visual analog scale ruler, and I asked him to rate himself on an anxiety ruler from 0 to 10. 0 was no anxiety, a 10 was the worst anxiety possible. He gave himself a rating of a 8 this past spring when things were really getting rough. Now this summer, he noted that rating dropped to about a 3, and that he's been pretty comfortable all summer. But then what had happened was I was supposed to see him this past summer. We were going to begin to do some work in heart rate variability training, M-Wave, HeartMath tools and techniques, etc. But he did not show up this summer. Now, I had a chance to start him on some vitamins or supplements, and those were going well. We talked about him getting in to see a psychotherapist and do some cognitive behavioral therapy, so we have him connected to do that. But I really hadn't seen him in about 6 weeks. So he came back to see me yesterday morning, and he had just started school this week. He'd only been in school about 4 days, and we had agreed at this visit we were going to review everything that was going on. It was about a 45-minute visit, and then start him on heart rate variability biofeedback training and learning some coherence building techniques. Well, it was very opportune because it turns out yesterday, as he discussed with me, he was actually having a math test 4 days into the new school year, so he was very anxious about that. And so it was a perfect time to really look at this and discuss it. So in my office at the time that we met yesterday morning, he said his visual analog scale rating for anxiety was about a 4 or a 5 because he was anticipating this mathematics test that very afternoon, yesterday afternoon. And so what I did is I explained to him the basics of heart rate variability biofeedback. I showed him that graph that I mentioned, I show all my clients where I show him an incoherent heart rate variability pattern, and then I show him a coherent heart rate variability pattern, and we compare them and talk about them and then discuss in a very specific way, which I did with him, the performance enhancement benefits of coherence and the coherent heart rate pattern. What was really fun for him to discuss was it wasn't just about anxiety, it was about performance, because he's a very competitive guy. So we could really talk about that cognitive shift that occurs when you are in a more coherent heart rate pattern, and all these benefits from a standpoint of mental efficiency and effectiveness. So he is kind of excited about that. And so what we agreed to do is the following. We did a 2-minute baseline tracing where I did not have him look at the screen, and then we engaged in a 4-minute quick coherence technique practice. And so we went ahead and went through that, and during this time of the quick coherence practice, I had him do it with eyes closed because this was his first time, but we talked about later that eventually, of course, I'd like him to be able to practice with eyes open. Well, he did a beautiful job. He got into 80% of the time he was in high coherence for the 3 to 4 minutes of the quick coherence technique just beautifully, whereas compared to his baseline, he was very, very low in coherence. He clearly was, struggling a little bit with stress yesterday morning. And so it was wonderful to be able to show him that beautiful shift. I mean, it was very powerful and clean for him. He had a very strong shift into not just a more coherent pattern, but very much increased heart rate variability amplitude, which is really fun to be able to show him as well. And what he said spontaneously the minute he got done with a quick coherence technique is he opened his eyes, he sat forward, and he looked at me and said, "Dr. Colbert," he said, "I feel so much mentally clear." So it wasn't that he said, "I feel less anxious" or "I feel calmer." He said, "It's like a veil was lifted, like my mental fog is gone." And the first thing he said to me is he feels so much more mentally clear, which I thought was really exciting. And we talked a little bit about then how we could apply this technique across the day yesterday up until the time of the test to prepare himself for that test, and then in fact use the same technique during the test. So he's pretty excited about that, and I didn't hear from him late yesterday, but hopefully I'll hear from him next week. But that's a great example of really talking through everything. We had run through with him the depletion to renewal plan and established his goals, which were mainly being successful academically, reducing stress, and certainly being less irritable with his family, and overall reducing anxiety and worries. But importantly, I think he felt a real sense of control and empowerment using this technique. He tried some other relaxation techniques, and I wouldn't say that he loved them, but this was exciting for him. It was very validating, and his father was sitting in the room with us, so the patient gave permission for his father to experience this with us, and the father was pretty impressed and blown away as well. So I think it was a great moment for them to connect and understand the benefits. And then we talked a little bit about a practice strategy for the rest of the day. So, great example of how you can use this stuff in the heat of the moment as well as longer term and get some really nice results and improve functionality. What we talked about with him in the days to come was considering a portable heart rate variability technology you could put on a smartphone. He liked that idea. Daily practice, maybe 3 to 5 minutes twice a day is what I suggested initially. That's all. But practice first in a place in a way that he's more controlled and not in a high stress situation, but then certainly begin practicing in those higher stress situations and using it in real life. So that's a great example of a good anxiety patient. And my fear for him is that he would like to use more natural strategies over time and control his anxiety, but if he does not get it under control, like what tended to happen at the end of this past academic year, he'll get into that same trouble again where I think he gets depleted from over-arousal. That's, chronic over-arousal. He gets burned out, he gets irritable, and he starts engaging in less than healthy coping strategies instead of doing the healthy things that will build his resilience. So anxiety treatment tips. these are people that you have to explain that when they first experience deep relaxation, by the way, and a more coherent heart rate pattern, they might not like it. Weirdly, they're so used to being, in a multitasking mode and high energy and high arousal that it might feel uncomfortable to them at first when they are not in that state. But reassure them that this is important, that you will get used to being, if you will, deeply relaxed and comfortable and quieted down in mind and body. And this will become a comfortable, in fact, desirable state for you, but you have to tolerate it for a while at first, and you got to hang with it. So you do need to warn them about that. Oftentimes I'll consider short sessions at first, especially with the technology, maybe no more than 4 to 10 minutes, because I think you can over-focus on technology as well, but I certainly do think it adds something, and it's very validating. Typically, I'd start with the heart-focused breathing technique and just use a simple screen, maybe not use audio input right away, just use the visual input, and then maybe, depending on what kind of client I think they are, in this young man, for example, I jumped right into quick coherence beyond heart-focused breathing because I really felt that he could do it. And I really felt like he needed that benefit and that additional step of the positive emotional shift. And then we talked about practicing both in a controlled way but also in the heat of the moment for his test yesterday, and I hope that it went well. So that's over-arousal and some tips on how to work with that group. Now, under-arousal, kind of the other end of things, oftentimes involves low energy and even fatigue. But it's interesting to talk about the fact that under-arousal and depression are not synonymous, in the sense that some people with depression definitely are agitated or anxious, but commonly I do see people that are very low energy depression and also can have low energy or under-arousal related to grief situations, chronic insomnia, or just being apathetic and disengaged, kind of that lower level depression we used to call dysthymia, now called persistent depressive disorder. But in those people too, I think that we want to be aware of, okay, what strategies do we want to use, and where do they want to shift to? And so clearly I think this person is in the lower left-hand quadrant and would eventually like to be shifting up into that upper right-hand quadrant. And how do you do that? I think that selection of HeartMath tools and techniques is important based on the depletion and renewal plan, and that in this case, when I'm trying to shift someone from lower energy, let's say a lower left-hand quadrant, and a lower energy and a depleting emotion, I commonly think about heart lock-in technique. I think that of all the techniques in the armamentarium or your toolkit, that is a really good one to think about because it helps people to sustain coherence for longer periods of time. And then we amplify the idea of that positive emotional shift by having them radiate that positive feeling to themselves and to others. And I love that. I think it's a really appropriate technique for depression in particular, by the way. Another thing I think about when people have under-arousal is this idea that maybe they got to under-arousal because of first being chronically over-aroused, but they didn't realize it. And I think that one thing to remember is this. For many of us, and I've experienced this myself, we experience under-arousal or fatigue to some extent on a given day in situations where maybe we look back on the day and we didn't think it was that bad of a day, yet we still feel really exhausted. And the question is, why is that? And I just want to remind people that I think what helps when we work with people in these HeartMath methods is that we help them to become much more aware of those depleting emotions, and even small ones. And so that what I find for myself is that I could have a day that nothing, was particularly bad on a given day, but I get home at the end of the day and I'm really tired. And I think that tiredness, this is true for many kids I see at school as well, is the result of many, many small stressors as opposed to one or two really big stressors. But because they're very, very small stressors, or periods of time where they're experiencing some other depleting emotion, confusion, anger, frustration, annoyance, whatever, stress, anxiety, worry, panic, because they're very low levels, let's say, of stressors, they don't really get too excited about them or think about them that much. But if you add together 20 or 30 of those on a given day, right, at the end of the day, they still accumulate and deplete you. And so that's important to remind people that we have to watch for those energy draining situations that maybe we didn't think were energy draining, but we have to become more aware of so we can stop the drain in the heat of the moment. I'll give you some examples. Meetings would be a good example. Technology glitches when your computer is melting down, feeling like you're overloaded with deadlines, which I've certainly felt a lot that experience in my work life. Unexpected changes, change is inevitable, and all of us are going through a lot of change, oftentimes at the workplace, but also in our personal lives. Emails can be very stressful and draining. Making decisions on a day-to-day basis, time pressures, workplace drama, colleagues that are really dramatic and difficult, financial issues, budget cuts, challenging coworkers that maybe are difficult to deal with and don't do what they're supposed to be doing, finding that balance of work and family, sleep disruption, even little things like traffic, nagging health challenges, headaches, minor injuries. But all these things you have to really think about can be energy drains and lead to this chronic under-aroused state or depleted state. And I think we tend to forget that. Now, under-arousal in terms of mental health issues, chronic anxiety, stress leading to deeply depleted state, commonly depression. There are many chronic medical illnesses that can lead to a deeply depleted state. Most commonly, I see a lot of chronic pain leading to deep depletion, and that's really difficult and sad for many people. This is for an example of what a depletion to renewal plan might look like for someone in a deeply depleted state. This was actually a patient that allowed us to show this, but you can see this person is over in the lower left-hand quarter and really feeling very low motivation to get anything done. And her goal was to kick things up over to the right-hand side, more energy and that renewing emotional state. It's interesting to note that not everyone wants to be in a state of parasympathetic nervous system activity or relaxation response. Sometimes that positive emotional shift can go with a higher arousal state, especially like at work when you need to get things done and keep things going. That's okay. That's what's, I think, fascinating about this depletion or renewal plan is we have both axes. We have the autonomic nervous system arousal, but more important than that, I think, is in fact the emotional shift axis, which is the horizontal axis, and really moving into that renewing state more often. You can still build a lot of energy as long as you're over on the right-hand side of that grid. And some of the actions, by the way, that really do help people to charge their inner battery and add energy to their system. Prep with a coherence technique to set the tone every day, and also take some time to reset and shift between tasks or between patients in my case. Find something to appreciate each day. Practice patience and kindness as part of your attitude breathing technique. Reset after a stressful interaction. So even if you can't practice a technique in the middle of an acute situation where you feel really upset or stressed, try to practice as quickly as you can afterward. Even for 30 seconds can really neutralize things, do a reset, and stop that energy drain. Oftentimes we hold on to that stress for a long period of time if we don't take the time to do something about it. Commit to taking out the drama, not overreacting, and commit to getting in sync so you emotionally regulate better and make better choices. Try to practice heart lock-in maybe 5 to 15 minutes, just 2 or 3 times a week to begin to build that new baseline. And those are some of the biggies that I think about and remind patients to think about over time. Now, here's what a heart rate variability tracing might look at that represents severe underarousal. You can see 2 things. Number 1, this person doesn't have much in the way of any heart rate variability amplitude. It's very, very compressed, falling mostly between maybe 88 beats per minute and about 92 beats per minute. So that's not much HRV amplitude. That's only 4 beats per minute. And for anybody at any age, that'd probably be a problem. Secondly, you see that this person doesn't have much in the way of coherent activity going on either, that the speeding up and slowing down of the heart is rather dysrhythmic or chaotic. It's not very organized. And so both factors, heart rate variability, amplitude, and coherence are impaired basically. And this would be a common person with depression. This would be what a tracing could look like. Oftentimes a person like this would be low energy, socially withdrawn, and certainly could be experiencing mental fog. And so when I work with people with depression, I want to definitely regain vitality by stopping their energy drains and having them understand where those drains are occurring. Even the little ones that are more frequent, they have to become more aware of those and get good at neutralizing those using heart-focused breathing or quick coherence, and then moving into those more renewing emotional experiences regularly by using quick coherence, heart lock-in, and attitude breathing. Over time, they'll start perking up, and they'll have that shift to a more positive attitude because they're practicing that emotional shift as part of quick coherence, heart lock-in, etc. every day. These are folks, though, that might need more work on achieving positive emotional states. They can find it hard to do that. So when we think about the techniques and we encourage them to visualize and then feel or re-experience a positive emotional feeling, a renewing feeling, that can be hard for them. So I commonly do recommend that they think about adjuncts like adding music, using photographs that they enjoy that elicit a positive response, utilizing and remembering sensory information that they know help them to be in a happier place. Maybe it's a smell that they remember, and they can use mental imagery to access that. Maybe it's a feeling tactily that they remember, the feeling of warmth of the sunshine while they're walking in the mountains or something. So oftentimes we use mental imagery, multisensory mental imagery visualization techniques with people to help them to access positive emotional states, because that may be hard for them early on. What we see in people with depression is that they get a lot of confirmation and validation from this idea that physiologically something is changing. Oftentimes there are people that can be pretty flat or apathetic in that low energy state. They don't get excited about much, of course, because they're depressed. And if you can show them, small changes in their physiology in response to practicing coherence building techniques, that gets exciting and momentum builds, and they get really engaged and are much more willing to practice when they can see those small increments of improvement in either coherence or heart rate variability amplitude. But sometimes that'll take a few weeks at a minimum with people that are severely depressed. Now, another interesting situation that is a classic for moving from overarousal to an underaroused state is PTSD. Commonly in those folks, we see in the acute phase that revved up autonomic nervous system, hypervigilant mind, and very sensitive, oftentimes, physiology in early acute phases of PTSD. But then over time, these folks can definitely burn out. They burn out their hormonal, adrenal system. They can burn out physically because, for example, they're commonly not sleeping. Their appetite may be low. They're not eating adequately or appropriately. So over time they can definitely burn out, and this is what you might see as a shift. You see much more heart rate variability amplitude, HRV amplitude here in this tracing, but and even a little bit of coherence, but certainly a lot of ups and downs in their heartbeat pattern over time. Whereas this one, you start seeing a more of a compression of the heart rate variability amplitude, and it looks like a bit more incoherence in terms of the overall pattern, and that would be typical as they move into that chronic phase and, you know, really experience some level of burnout. Heart rate variability has been shown to be quite useful in terms of working with people with trauma, PTSD. Just remember that obviously scope of practice issues are important, that taking this course doesn't necessarily qualify you to work with people with PTSD unless you've already been doing that. But certainly heart rate variability work with people with PTSD has been shown consistently to be very helpful. And also the heart rate variability work can be combined with other forms of psychotherapy, and that's perfectly fine. What we like to show people is that in PTSD in the acute phase, when they're hypervigilant and very elevated in terms of their autonomic nervous system arousal, it's nice to be able to see these more objective measures and help people to begin to shift in a very concrete way to a more balanced autonomic nervous system response. And it can be very insightful for them and informative for them to see how their emotions are changing and then their physiology is changing in tune with their and in sync with their emotions. And that's why I think using technology with these folks can be really useful, because it can show them that this ability to internally generate positive emotions using a coherence building technique like quick coherence or a heart lock-in or attitude breathing can then influence their brain activity. So it's that bottom-up influence. That's exciting for these folks, because I think sometimes they can feel like it's so out of control when they have these intrusive, sometimes seemingly uncontrollable re-triggering, if you will, of these PTSD-related memories and physical responses. So it's nice to know they can get some control over that. They can generate this bottom-up response. And when the heart goes into that more coherent pattern, their limbic system, their emotional control system, better regulates itself. And that's, I think, really helpful. It's also important to remember, and in kids, that PTSD can present differently. And sometimes kids, it's more subtle. I see a lot of children where clearly it's this sudden, unexpected development of separation anxiety, or a new sleep problem that they didn't have before, or also aggressive behavior. That's a very common manifestation. And then finally, even somatic complaints. I see a lot of kids with unexplained stomach aches. They've been worked up by gastroenterology. You really go through a very detailed history, and it's very clear they've experienced some trauma that they maybe hadn't told anybody. So I also think in kids, this is a useful technique and approach, but we have to understand that it presents differently, and we have to be ready for that. The bottom line is that limbic system overstimulation and trauma can be partially controlled through this bottom-up heart-brain communication phenomena. And when we initiate coherence in our heart, we send these ascending messages, afferent vagal activity, to the brain, calms things down. Heart-focused breathing can be useful in this situation, along with quick coherence and heart lock-in for longer-term restructuring, of course. Now, let's finish up by just talking a little bit about special populations. Sometimes with children in particular, but also potentially with adults, we see situations where we have erratic arousal, that it's not this chronic, longer-term over-arousal to under-arousal pattern, but it's literally every day they can be over-aroused and under-aroused repeatedly, even within a few minutes. That's what's so fun about kids, I think, in a lot of ways. And that's not necessarily abnormal, but it can be difficult for them, because depending on the situation they're in, if their arousal level is inappropriate for that situation, oftentimes they'll get in trouble because they'll engage in behaviors that are not appropriate for that situation. So drug addiction is one example of erratic arousal potentially, but oftentimes we think about things like ADHD where these kiddos can be really inconsistent depending on the situation and the time of day. And so a few things about ADHD. Heart rate variability biofeedback can be really useful for emotional dysregulation associated with ADHD, but also helpful over time with retraining the brain to be comfortable with that more quieted down state of mind and body. We know that in that coherent state, we're a more efficient mentally. We can get more done, I tell kids, more quickly, but still in a high quality way, and we can learn to sustain attention better. So I think protocols for ADHD commonly would involve, I would say early on, visits probably twice a week for 30 to 45 minutes for 2 or 3 weeks, but frequent shorter practices both in the office and at home, and then use of a lot of games, and then have kids track a symptom diary over time with regard to targeted symptoms along with their parents and their teachers, such as inattention, impulse control, and hyperactivity, and see if there's some way to, using visual analog skills, for example, or standardized ADHD rating scales, see an improvement in those parameters over time. These are kids where I use a lot of the biofeedback games to keep them practicing and sustaining coherence for longer and longer periods of time every day. And I think it's really important to use reinforcers. So definitely having daily or weekly rewards is perfectly appropriate, and rewarding them in particular for practice. In general, using heart rate variability technologies with kids, with whether it's anxiety or depression or ADHD, I usually will start with 6 to 10 sessions. They may or may not also be seeing a therapist, or you may be integrating various forms of psychotherapy into these sessions. I usually begin with a quick coherence technique, and we start with maybe one simple goal. You know, quit hitting your sister. Do a better job sitting still in math class. Let's try to decrease the time it takes you to facilitate sleep onset from 90 minutes to 30 minutes. We want to do a lot of reinforcement and rewards with them, and then still I would expect some level of daily practice. Usually I try to structure that in an organized way. 5 minutes of practice before school, 5 minutes of practice maybe before homework, right when you get home from school, and then 5 minutes of practice right before bedtime would be a common example. And then some of the techniques that we've talked about have been translated into kid language, and that's been helpful as well to make it a little bit more developmentally appropriate. Now, secondly, I've worked with a lot of people in the HeartMath tools and techniques in acute care settings. So I worked for 10 years at the Children's Hospital here in Minneapolis, and we use these techniques in on the oncology ward and also in the ER, and they were beautifully useful and accepted and very effective. We used them for pain, nausea, procedural anxiety, needle phobia specifically, and also kids that were having trouble with sleep onset. And what we find is that kids love it because it's technology related. So I always had the technology available portably on a laptop that I brought around with me to the ER or the oncology ward. And then we talked about these being like video games for your body. But I think the beautiful phenomena involved here is this shift for these kids from feeling like everything is out of their control, which we call an external health focus of control, to feeling like they have some control over their own health and wellness, called internal health locus of control. And they learn and understand and see that they can control, for example, their heart rate variability pattern. So I use a lot of the games available for HRV, different technologies and software and hardware. I've used all the different types, and but it can definitely be used in acute care settings for symptom management. Highly recommended, even in the ER. It's been a wonderful thing for pain management and then procedural anxiety as well as nausea, for example. What we do know is that as we increase parasympathetic nervous system influence in general and activity, generally pain tends to go down. And so it's one of those things that you can use in acute settings quite successfully. I also want to mention that we've definitely also done a lot of work with HeartMath tools and techniques in group populations. So here at the group that I work with, we've done anger management groups for teenagers as well as stress management group for teenagers. And the typical group approach with HeartMath tools and techniques would involve, usually I'd say about 8 to 12 people would be ideal for a group size. And then typically, if you can, we commonly will do some work before the group with each individual, have one session where they get pre-tested on your HRV device, and you just get a baseline recording with them, get a little bit of a chance to explain some of the basics to them so that they're more prepared for the group. Also during that time, you could establish with them what are their goals in terms of the depletion and renewal plan. And then usually you might spend one group session educating everyone in the group on this concept of coherence and how it applies to the topic at hand. So if it's anger management versus a chemical dependency versus anxiety group, you know, why would it be relevant for that group of people? Pain management group is another possibility as well. Provide education during the group, and then I like to have everybody practice together. Oftentimes at the beginning of each group session, typically these have been paced one a week. Usually the group sessions go for about 60 to 90 minutes, the ones that we do with teenagers, and the focus is typically on anger and anxiety in general. But that's been a great format. What we find is that once they achieve coherence early on in the group setting, at each session we do, you know, a 5 to 10 minute heart lock, and let's say they're more open to then discussing things and sharing things with others, and they tend to be even better listeners and a bit more respectful, and obviously they begin to emotionally regulate better. So it's been a really great way to do it. You can have everyone in the group purchase a portable HRV technology, or in our case, what we did is the clinic bought about 12 of these little handheld HRV devices, and we just have people use them in the groups as needed. We clean them afterwards using an appropriate solution, but that's worked out well also, just to have them available for the group activities, but not necessarily have people buy them on their own. But that group dynamic is wonderful, and then we, as mentioned, you know, usually run them for about 8 to 10 sessions total. There's some information in the HeartMath course manual that talks in more detail about how to work with groups. All right, well, hopefully we've given you some good, helpful ideas about the multi-session protocol, how to consider people with under-arousal versus over-arousal issues, and how those two can relate over time. Working with special populations, we just touched briefly on group settings, acute care settings, and working with children. We hope that you will stay connected through the HeartMath Learning Center. Remember to take care of yourself, monitor your own self-regulation, and practice every day with self-care techniques. Recall the prep, shift, and reset and sustain ways that you can practice. Hope you've enjoyed this class and this course, and let's end with a lovely quote by the founder of HeartMath, Dr. Childra. He said the following: "Look at stress as a challenge to strengthen the power of the heart. Through the heart, stress and anxiety can be intelligently transformed." I wish the best to all of you, and thank you so much for completing this class. Bye-bye.